Welcome to today's webinar. I'll give folks a couple of seconds here to continue to log in. Thank you for joining us today. My name is Stephen Aquario, and we're here offering a webinar on strengthening public health, how counties are leveraging the New York HELPS program to build their workforce. Again, I'm Stephen Aquario. I'm joined by Alexandra Regan from the NISAC offices, and on behalf of our president, the Honorable Benjamin Boykin from Westchester County, New York, thank you for attending. Today's webinar comes at a critical time for local health departments across our state. And as we'll hear about more shortly in a few moments, county health departments are facing significant workforce challenges following years and years and years of disinvestment or the inability to make a proper and healthy investment in the local public health infrastructure and the unprecedented strains during the pandemic response. Many counties continue to struggle. They're struggling with critical staffing shortages across multiple positions, and you know what they are. That's why you're on this call. Difficulty recruiting qualified candidates in a competitive, very competitive public, state, local, private sector job market. Long waiting periods for civil service posting, examinations, review, high vacancy rates in essential positions, and the urgent need to replace retiring staff and expand services to meet the evolving community needs. New York HELPS program has been a lifeline, and I'd like to thank Commissioner Timothy Hoags from Erie County, now the New York State President of the New York State Civil Service Commission, and the wonderful staff from the New York State Civil Service Department Municipal Services Division. Most importantly, I'd like to thank and recognize Governor Kathy Hochul for her commitment to help properly staff our health departments by expanding the New York HELPS program, the New York HELPS program. The New York HELPS program is the New York hiring for emergency limited placement statewide. It offers counties practical solutions to address our workforce gaps that we just mentioned, or that I just mentioned. The program allows our local health departments and many other county departments to hire qualified permanent employees quickly without traditional examination requirements. It enables us to build a more diverse public health teams through streamlined recruitment. It helps us convert provisional appointments to a permanent position, and it helps strengthen our local public health capacity during this critical rebuilding period. And again, I would like to thank our Governor, Kathy Hochul, for making this a reality. So today's agenda, we have an outstanding lineup of speakers who will provide both program details and practical implementation insights. First, we'll hear from the New York State Association of County Health Officials, my great friend, Sarah Ravenhall, who will provide an overview of the current workforce challenges facing our local health departments. We'll then hear from the Department of Civil Service, who will explain the New York HELPS program, its structure, the eligibility criteria, and the application process. And then finally, we'll hear from Ontario County how they've used the New York HELPS program to hire more than, did I get this right, more than 180 people across 30 county and municipal agencies. Congratulations to Ontario County. We'll conclude with a Q&A session where our panel of experts will address your specific questions. And I really encourage you to ask even the most simple, basic question about New York HELPS. If you're thinking of it, then somebody else can benefit from your thought as well. So please, at any time during this presentation, hit that chat button and submit your questions, and we'll take those questions at the end. Let's go to our first presentation. Oh, Jeanette. I want to go to Jeanette Stanziano, also from the New York State Association of Counties, to set the stage here for some housekeeping announcements about this recording. Jeanette, I'll go to you first.
Thank you, Stephen, and welcome everyone. I want to let you know that we will be recording this webinar per usual, and you can find a link to the recording as well as a PDF of all of the slides at nisec.org/webinars. Just look for today's date. As Stephen said, we want to encourage you to feel free to submit any questions for any of our speakers by referring to your dashboard and clicking on the Questions tab. Type in your questions under the Questions tab, and we will refer to those questions and address them during the Q&A portion following the presentations. Back to you, Stephen.
Okay, thank you, Jeanette. Before I introduce our speakers for today's panel, I really want to give a great shout out to my great friend, Sarah Ravenhall from the New York State Association of County Health Officials, NYSECHO, for helping us to co-sponsor this webinar. We're joined by their executive director, Sarah Ravenhall. Sarah, I'll turn it over to you.
Thank you so much, Stephen. The first step to successfully leveraging the New York State HELPS program is really understanding what it is and how it can be a powerful tool to recruit and retain workers in local government, especially in local health departments in the public health field. Our association was founded in 1979, and since then, we've been a steadfast advocate for New York's local health departments and the governmental public health workforce in New York State. We've long tracked the challenges counties face with recruitment and retention, but under Molly Fleming's recent leadership at NYSECHO, we've been able to dig much deeper. Her work has helped to identify the most difficult positions to fill in local health departments. These are roles that are also critical to meeting our public health law statutory obligations as counties. So when we're thinking about core public health services, these positions ensure emergency preparedness in communities, that we're addressing chronic disease rates and putting programming together to address this. We're providing environmental health services and protections. We are ensuring that families and babies are getting a healthy start to life. Positions like nursing positions and administrative positions, health educators, epidemiologists, environmental health sanitarians, and so many others are really difficult to fill because there are competing sectors. The private sector sucks up a lot of these positions, and they offer really high salaries. And there are also, as you know, hospitals and other direct care provider agencies that offer sign-on bonuses where the nurses tend to go and accept positions. But there is such a benefit to working in local government because all of you are doing that with great passion. And so programs like HELPS really help us to protect the public health workforce, recruit and retain these really, really important positions. It's encouraging to see so many counties prioritizing these hard to fill positions within local health departments. And this focus is really key to ensuring our communities remain safe and protected locally. Today's webinar is really designed to share how HELPS has already been put to good use at the local level and to also encourage counties to submit eligible public health positions that haven't yet been included so we can maximize this resource. We're incredibly grateful for the strong and ongoing partnership with the New York State Association of Counties. Thank you to Stephen Aquario for his leadership, Alexander Reagan for coordinating with Molly Fleming on today's panel, and to all of the fabulous presenters that are here today to share information with us. Thank you for the opportunity. I'll turn it back to you, Stephen.
Okay, Sarah, that was Sarah Ravenhall, the Executive Director of the New York State Association of County Health Officials. Thank you, Sarah. Let's get right to it. Let me introduce our panel at large here. Let me read all their names first, and then we'll go in the order that I'm reading here. First, we're going to hear from Molly Fleming, the Associate Program Director for Workforce Development from the New York State Association of County Health Officials, NYSECHO. Then we'll hear from Anthony Rotundo from the Municipal Services Division, State Department of Civil Service. He'll be joined by Doug Bartels, also New York State Civil Service Department, the Municipal Services Division. And then we'll hear from our friends in Ontario, County Department of Public Health, Kate Odd and Michelle Smith. Now I'd like to turn it over to Molly Fleming from NYSECHO for an overview of the workforce challenges our local health departments are currently facing. Molly.
Thank you, Stephen. So can we go to the next slide? Perfect. So I'm today just going to be kind of level setting by sharing some vacancy rates for specific occupations in local health departments. This data is all from NYSHO's ongoing enumeration study. Every year we survey our local health departments to collect information on how many full-time equivalents they employ, broken down by various employee types as well as occupations. So this data is going to show those vacancy rates as of 2024. And I'm going to go through these kind of quickly, but these slides will be available to you all following the presentation if you want to review more closely. So to start off with nursing and clinical roles, and thank you, Sarah, for doing such a good job level setting as to why these positions are so important. Public health nurses had a really high vacancy rate at almost 40% statewide. And all clinical roles really had pretty high vacancy rates. Registered nurses had the lowest at 16%, but that's still very high considering the really critical role that nurses and other clinical roles fulfill for local health departments, like providing vaccinations and doing health clinics. So next slide. For environmental health positions, which do really a critical work like inspecting restaurants and lead remediation, protecting the environment people live in, environmental health technicians had a really high vacancy rate at almost 30%, but environmental health sanitarians and environmental health engineers also had pretty high vacancy rates. 9% might not seem high compared to 20-something, but when you're thinking about almost 10% of environmental health sanitarians being missing, that's quite a lot. For data and technical roles, epidemiologists had the highest vacancy rate at 32%, but again, really high across roles, with laboratory workers having a 26% vacancy rate, information systems specialists having a 20% vacancy rate, and communicable disease coordinators and investigators having a 13% vacancy rate. Next. In terms of administrative roles, who are doing things like maintaining grants and reporting for those and all the things that keep a local health department going day to day, they also are pretty hard to hire, with 20% vacancy rate for business and financial operations staff and 17% for office and administrative support staff. Next. And then finally, for agency leadership and other more public-facing roles, agency leadership, so those commissioners and directors, have a 5% vacancy rate, which is the lowest out of all of the occupational titles we collected data on. However, when you think about 5% of local health departments missing that top leadership, that is concerning. Preparedness staff had a 12% vacancy rate. They're the staff that are planning for extreme weather events, for disease outbreaks where they might need to plan a mass vaccination event or a mass vaccination pod. Health educators, community health workers who are really out there in the community, making sure community members have the information they need to access care and healthy choices, are also both over 20% vacancy. So overall, really concerning numbers for a lot of different occupations. And a large reason for this, as Sarah mentioned, is salary, but also civil service can be a barrier. It can be intimidating. And so the New York Helps program offers a really good opportunity to get people into these roles and kind of circumvent one of the biggest barriers to hiring for local governments. Next.
Okay, Molly, sorry about that. Okay, sorry about that, Molly. Thank you very, very much for setting the stage and for all the great work and surveying that you've been doing here. I want to recognize Anthony Rotundo and Doug Bartels from the State Department of Civil Service. And again, I can't thank our governor and our state commissioner, Tim Hoax, enough for concentrating on the New York Helps program, created in 2003, extended to local governments in 2024, and re-extended in 2025. We can't thank you enough to the New York State Department of Civil Service. Anthony, I'll turn it over to you.
All right, thank you very much. So my name is Anthony Rotundo. I'm with the Municipal Services Division, which is a division of the New York State Department of Civil Service. Our role is to provide technical advice and assistance to local civil service agencies, and they in turn administer civil service for over 360,000 local government employees. So we do the support and technical assistance in a lot of different ways, two of which are indicated on the slide here, which are mostly germane to the conversation today. We conduct a lot of training. We work closely with the New York State Association of Personnel and Civil Service Officers. Anytime there's a change in the law or a policy or anything like that, we keep them in the loop. That's a great organization. They have great leadership, and the goal of working with them is to make sure that information is received. And when it comes to the New York Helps program, this is who we are working with. We work with the local civil service agencies to make sure they're aware. The program has been extended in the past, so they are sort of our experts out at the local level. So another thing we do that's relevant here is that we review and analyze rule changes from local civil service agencies, and we'll get into how that comes into play later. But in order to participate in the Helps program, it involves changes to local civil service rules. Thank you. And so what actually is the program, right? We've been talking about it. So, you know, and it's this nebulous thing, but what actually is it? So really, it's a temporary measure that allows for employees to be appointed on a permanent basis without requiring an examination. And we'll get into how that works a little bit further into the presentation, but you know, our department is actually in the process of undergoing a exam modernization effort. A lot of opportunities for modernization were exposed in recent years, and our testing staff is dedicated to sort of creating a new way for exams to be done quicker, and so that public employers can be more competitive in recruitment. And while that's happening, there are fewer exams that are going to be available on the normal schedule that we keep. And so because of that, we have the Help program. And this program, again, we'll get into it in more detail, but it's helpful for situations where you have positions that are difficult to recruit and situations where maybe you have a provisional. So I'll point out here just on the slide, it talks about how it's typically for filling positions that are filled through an open competitive examination. And the key point there is that the eligible list does not need to be exhausted. So this program has been extended and expanded a couple of times, and this is the current iteration, which is the most inclusive version of the program. So we'll get into more of the criteria on the next slide. We can also use it for promotional positions. So that is also a new stipulation. So how do you know what positions can be included? So basically, if you look at the slide, any position that meets that criteria that's bulleted is eligible for inclusion in the program. The exceptions are we cannot approve peace officers, police officers, or members of the fire service. And so you'll see here it says there's no mandatory preferred list. Preferred lists result from a layoff. So you'd have to talk to your local civil service agency to find out about that. Okay, like, is there a mandatory preferred list for that title? You would have to work with civil service to make sure that diversity, inclusion, and equity principles are integrated into your outreach efforts. And then you would just have to attest to that on the submission that comes to our office. And then also there could be no mandatory promotion list. And again, your local civil service agency can help you figure out whether or not there is a mandatory promotion list. And once again, the existence of a mandatory open competitive list does not prevent a title from qualifying for the program. Next. So just in terms of some numbers, around a year ago, this is what the numbers looked like for the Helps program. You can see that 48 counties had already jumped on board. There was, over 2,000 actual jobs that were filled through the Helps program and 672 titles. And that was pretty early on. And if you look at the next slide, this is current as of about a month ago. You can see those numbers have increased pretty dramatically. So there's a lot of counties out there making use of the HELPS program. There's still maybe 4, I believe. I think there's 56 counties. So there's still 4 that are not participating. So that's one of those things where you might want to reach out to your county and let them know that you're interested if you have positions that meet the requirements. Next slide. So we maintain a list of titles that have already been approved for the HELPS program. It's my understanding you'll be receiving a copy of the presentation, so that link will take you to that list. And as far as how do you get your titles included? Well, I would suggest if you look at that criteria that I mentioned, you can, on your end, you could look for titles that are difficult to recruit and just bring those to your civil service agency and let them know you've heard about the HELPS program and you're interested in maybe getting these titles included. And then they would go through the rules change process, which is provided for in Section 20 of the Civil Service Law. And so if you are unsure who to contact, if you're not sure what your local civil service agency is, there's another link, the Job Syncer link there, and you would access that link. And every county has its own local civil service agency. And so we're talking about health department stuff. So you should just be able to find your county, and that would be the appropriate civil service agency to contact. And then that would be the group that you work with to get this done. As I said, they'll have all the information relevant to your request, and they could confirm whether or not it meets the criteria. And so we actually cannot force local civil service agencies to participate in this program. So, it really would be up to you to sort of advocate for the positions that you want to be included. And just to give you a perspective, our state commission meets once every month, and every month they have about 100 HELP resolutions on their commission calendar. So we do process quite a few of these, and we prioritize them as they come in. Next slide. Okay, so this is just a quick depiction of the top 10 agencies that have been making the most use of the program. So these are the highest numbers of appointments per county. So you can see Albany County, Suffolk County, Onondaga, and on down the list. So if you're not sure whether or not your county is participating, again, just contact them. We'll let them know you're interested. And if they have any concerns or questions, they would contact us, and we could sort of help them through it. So specific to this group, I think you're probably all familiar with the Public Health Fellowship Program, I'm sure. And you're probably also familiar with the fact that the funding for that program is now gone. This program would be a good opportunity to hire some of those people. If you're able to get a position classified by civil service and then funded, this program would be a great way to hire those people back on a permanent basis. Because again, there's no exam. They would be, once the title is removed from the rules, is added to the rules, sorry, like I was alluding to before, you'd be able to make non-competitive appointments to it. And then once that title is removed from the rules, the people would gain permanent competitive class status. So the HELPS program would be a great way to make use of that talent that's out there that's already been trained and has some really good experience. Next. How long can a position stay in HELP status? So a particular position stays in HELP status until the title is deleted from the appendices of the local civil service agency rules. So again, it's that Section 20 process that I mentioned before. And then as long as that title is in the rules, non-competitive appointments, once it's removed from the rules, non-competitive appointments can no longer be made. And they could also no longer be made once the program ends. And it's currently scheduled to end on June 30th of 2026. Next. Okay, I sort of alluded to this, but how does a HELPS program mature into a permanent competitive class appointment? So again, once it's deleted from the rules, the local agency has to take overt action to do that. They have to have a public hearing, adopt a resolution, approve it at their commission meeting, send it to us. Our commission would approve it likely, and then it has to be filed with the Secretary of State. So once that process happens and the title is deleted from the rules, it would become a permanent competitive class position. There is another way that can happen. So local civil service has what we refer to as the rules of the classified service. Each local agency has that. And we have model civil service rules that we recommend, one of which is for allowing qualified incumbent examinations. And for titles that are in the HELPS program, if an agency has this rule, they can administer such an exam, which is locally developed, and it's very, very not complicated. How's that for proper grammar? But it's an exam that's locally developed and can get people permanent competitive class status without having to delete the title from the rules. And that way, additional appointments can be made to that title. Next. Does the criteria change county by county? No, it does not. What you will see, though, is that counties might have prioritized requests for positions differently. So there might be a different list of approved titles per county. So, for example, if you see a title, registered professional nurse approved in one county, but not another one, that would be the reason why. It just means it hasn't been considered for that other county yet. So, yeah, and again, if you see that, you would want to approach your local civil service agency to let them know, could you look into this? We think this qualifies for the NY HELPS program. Okay, if the program is successful, will we migrate to a permanent system? So no, the HELP program is temporary in nature. It's currently scheduled to expire June 30th of 2026. But like I said, we're working on that exam program. And our intent for that program is for it to operate similarly to the HELPS program with the same speed so that you can make appointments without having to wait. And I have a slide in here that'll talk about why it takes so long to score the exams. But we have taken all that feedback into consideration, and our goal is to make it so that whatever replaces the HELP program will be just as fast. So, and here we go, scoring. Why is this such a long process? So currently, every year, we have a schedule of exams, and our testing services division has to do the following things for all 95 local civil service agencies. So you can see they manage 5,000 exam requests. They group them into 70 exam series, which are scheduled on 15 different dates. They have to create over 700 different test plans in different job-related subject areas. They process and analyze exam results for 45,000 candidates. And they process candidate reviews and appeals of new test material, as well as reviewing and releasing over 5,000 electronic score rosters. And that's after all the materials get shipped back to us, which can also take some time. So this is why the scoring process takes so long, and this is the main thing that we're trying to address with the new exam program. We want to make this we want to make it so that this goes a lot faster. And the last thing I had to say on the next slide, what can we expect long term? So this new project that we're working on, the plan is for it to create increased opportunities for individuals to compete for positions in public employment. We want to make sure there's a refreshed, diverse pool of candidates that are very qualified. That's one of the feedback points that we received, is that sometimes the list doesn't really produce that. And really, we want to make it more competitive with the private sector. We want you guys to be able to get them before they're caught up by somebody else with a better offer or a faster offer. And eliminate rigid structures that are barriers to entry. So there could be things about the exam process that make it really difficult for people to get into the public service. And ultimately, hire talented and diverse candidates in a compressed time frame from application to employment. So we want to shorten that time and make it more competitive for all of you. And that's all I have.
Okay, Anthony and Doug, thank you. And again, thank you to our commissioner, Tim Hogues at the New York State Department of Civil Service, to all the employees of the State Department of Civil Service for your work with the municipal civil service commissions and departments. You guys do a great job. So thank you very, very much. Let's go to, and just a quick reminder, please submit your questions in the question line on your dashboard there. We have several that have come in, and we hope to address these following the great presentation from our friends Kate Ott and Michelle Smith from Ontario County. From Ontario, the floor is yours.
Great, thanks. Hi, my name's Kate, and I am the Public Health Director for Ontario County. So a little background on our county. We're here in the Finger Lakes region. We have about 112,000 residents and about 1,000 employees. My department, Public Health, has 25 employees. So like all of you, I work closely with HR, when I'm hiring or disciplining, but also on the Wellness Committee and at monthly county leadership meetings. I first heard about the HELPS program at a leaders group meeting when our county administrator and director of HR noted that they were applying for HELP status for some DSS positions. I didn't think too much of it. I knew historically it was difficult getting DSS staff, and I assumed that the program would only apply to those really hard to fill positions. We in public health, though we've had a very limited number of applicants, sometimes just one or two for a position, we ultimately were usually able to fill our vacancies. My first inclination that something was afoot more broadly in the county was after we had created a new position in 2023 of public health specialist. So our candidate had been working in the position and he was ready to test, but received notice of cancellation. So I talked to HR and learned that Michelle, our HR director, had applied for and received HELP status for the position. So you can imagine our employee was thrilled, and I was also very happy, and it led to a lot more questions from me, including, are you going to do all of our positions? So I was told at that point, as positions became vacant or were created, that HR would request HELP status. So this has been great. Since hiring our public health specialists, we've hired a senior clerk under the program. We advertised the position as test exempt, and we had a much broader pool of applicants than we usually do for that position. We're now waiting to hear if our director of quality improvement position in children with special needs part-time coordinator position will also be approved. As a director, my advice is stay informed and ask questions. Frequent communication with HR is really important. Find out what their plan is in your county regarding the HELPS program. Are they requesting it for some positions or all positions? Are only squeaky wheels getting the oil? If so, be squeaky. Many of us have lost really good experienced employees who had a bad day when they tested. Even if HELPS isn't an option in your county or for your positions, make sure that your job descriptions are up to date, detailed, and accurate. And read those test descriptions, and if they don't make sense, speak up. So that's it for me. I'm going to turn it over now to Michelle Smith, who is Ontario County's Director of Human Resources, and she's going to discuss her process, the timeline, and the activities involved in applying for HELP status. Thanks. Michelle?
Okay, we're waiting for Michelle to join us. Are you there, Michelle?
Sorry about that. I think I unmuted at the same time that they were unmuting, so we crossed each other out there. But I wanted to thank Kate. As you can tell, she's a great advocate for her staff and does work closely with HR in terms of their needs and the things that they're looking for in terms of their positions and qualified candidates. This first slide was pretty much covered by state civil service. Sorry, back please. There we go. So I was going to move on to this slide. The one thing I wanted to point out on the first slide is the program has been extended, as Anthony said, to June of 2026. So there is still lots of time to utilize the HELPS program if you are not yet a beneficiary of it with your jurisdiction, to go to them and ask for them to kind of work through the program because there is still plenty of time to take advantage of it. One of the things that I wanted to point out, again, this is the same criteria that Anthony went through with respect to the benefits of why the HELPS program is good for us in terms of getting qualified candidates in a non-competitive basis and a permanent basis. The bullet point at the bottom there with respect to a diversified candidate pool, we've seen to be a great benefit. It's actually a requirement of why we did the HELPS program or why we were strong proponents of it. But we've seen through many of our positions that have been granted the HELPS status, that we are receiving a more diverse pool of candidates. That, as you all know, exams themselves, just having an exam tends to be a barrier to getting applicants from many minority groups, and eliminating that increases people's willingness to apply for a position. In addition, just having to apply and know that they have to wait for the process, people want jobs now. And so these really are treated as private sector kind of positions that people can apply for and get hired fairly immediately in terms of a public sector job. For our department heads, as soon as they see an approved application, they can start interviewing that person. So unlike with our exam things where they couldn't interview until their list came out, they see applications as soon as they're approved by my office. So they can start interviewing and hiring immediately, which is obviously significantly quicker than the exam competitive process. Next slide, please. As Stephen had mentioned, we are utilizing this. I'm a little jealous of the 9 counties listed ahead of us in terms of how well they're doing. We thought we were doing pretty good. We've submitted pretty much every title that we possibly could, in the sense that if there was a provisional appointment, we put in a title to get it a helps designation. If it had been a vacant position, if we have low list numbers, no lists at all, we've submitted everything that possibly could be submitted and anything that comes available to us. Since the slide deck was put in, we actually got 15 more approved titles. So we got that notice on Friday, and one of them is Kate's coordinator of children's services part-time. So she'll be glad to hear that as we're talking about this. As I said, we did do a priority of provisional appointments, which we think is a very intimidating and daunting process for public servants in the competitive field. And unfortunately, as Kate knows, we did have a situation in public health with someone who'd been in a provisional appointment for over 3 years, and then unfortunately was not reachable once the exam came out. So provisional numbers are important to us, and we currently only have, because of the HELPS process and program, only 26 provisional appointments in all of our Ontario County agencies. So that's out of over 1,200 competitive positions, normally competitive positions. And as we mentioned, it was 179 people that we have appointed that are still in the position. So we have had issues where I think we see department heads are not as willing to keep people when they know it's not a struggle to get them, but also the people themselves may not be a fit for the position. So there have been some situations where for our caseworker or SWE positions, things like that, it's not a good fit for the work that they're doing and the candidate. And so we move on. So, but of the appointments, we were at about 179 who've maintained their positions. So we're very excited about that. Next slide. Okay, so for the public health people, these are the titles that we have had approved. Again, public health educator and the specialist and the senior clerk. And then, as I mentioned, down below that, the coordinator with children with special needs was just approved as well. So we're just waiting on one more title in public health. And then, as you can see, 3 or 4 of those titles do have provisional people in them. Unfortunately, we didn't catch one before he actually took the exam, and we did appoint him off the list instead so he can maintain competitive status, but we still have that title for in the future if needed. Next slide. Okay, so I know Anthony had mentioned the rules process, and this is kind of just a workflow for you to see how that actually works. In civil service, it can seem a little daunting, and that may be why there's some reluctance for the local jurisdictions to go through it, because it is a multi-step process and can be very time consuming in the sense it requires a public hearing. So you have to advertise it the old fashioned way, actually hold the public hearing with probably very little people coming to comment on it, but then you have to put that in minutes and do a bunch of other kind of official things to submit that to the state for the state to adopt it. But once you've done it once, it's actually very easy to duplicate. And so state civil service has actually made it very easy with respect to the HELPS program, in that they've actually given us all templates so that we can kind of go through all of these steps with minimal effort on our part and actually almost have like a fill in the blank. So if you see the next slide. Here's some samples of what they've given to us, right? So they have a cover sheet that you fill out, and you can see the municipal service appendix, because that's what a rules resolution is we're asking for an amendment to our own local civil service rules. And the appendix is where all of our titles listed and are classified either as competitive, non-competitive, exempt, or so forth. So we're asking to amend that rule to actually put, as you can see on the second part where it says the resolution, to put that parenthetical around the title, to remove it from the competitive class and make it be non-competitive under this temporary program. And then the bottom spreadsheet on the bottom of this slide basically shows you what you can do so that you're not submitting one resolution for one title. You actually can list multiple titles on one spreadsheet and submit that to the state as well. And then the staff there will kind of help you get that in front of the commission for their review and approval, and then kind of move it along with all the other supporting documents. Next slide. Anthony mentioned this, that there can't be some titles submitted, and it's really kind of a small list. I mean, the only real issue that you can't do is the police, public safety type positions, police and fire. And then with respect to promotional titles, that those two can be submitted under HELP, and the only qualification generally is that if you have people who would be eligible for a promotional exam, that you make an offer to them before you move on to anyone outside the organization. I'm going to move to the next slide. There is always some concern with respect to the HELPS appointment. As I mentioned, they are a non-competitive appointment because they haven't taken the exam. As Anthony mentioned, there is a process to either move them into the competitive class through the QIE or through deletion of the title from the HELPS status. We don't intend to do that last one until we get to the end of the program. So currently in 2026, we'll submit for that, but we will be doing the QIEs to move people. In Ontario County, we do use our probation period, the full probation period for all of our appointments. So we wouldn't even be ready to kind of move some of these people. Actually, probably coming up this year, we'll be moving them under the QIE to get them competitive status. And that's really the only difference in terms of their rights under civil service law, under competitive status, and also their eligibility for promotional exams that still may be not HELPS qualified. And I think that's everything for me.
Okay, I want to thank all of our employees. Thank you, Michelle. Let me just take a moment here before we take some questions. We've got 15 minutes, and I just want to take a moment right now to thank all of you, from Sarah Ravenhall and her work at leading our local health departments to our county local health departments, our public health departments, and all the officials for your unwavering dedication, your tireless efforts in keeping our communities safe and healthy, your commitment, especially during challenging times like we went through with COVID, does not go unnoticed. And every day I think about our work together with NICEHO here at NICEC. We are forever grateful for your courage, your expertise, the sacrifices that each one of you make every day to protect us all. Thank you for being heroes in our communities. Let's take some questions right now. We have a few questions that have come in. Please send in your questions right now, and we'll take them in the next 10 to 15 minutes that we have. A comment that we had come in here, just a comment. The county had 3 staff that had been provisional for longer than 5 years. In other words, waiting for a test to be held. They were able to become permanent employees through this program. So that's a great shout out to our governor and to the Department of Civil Service. Question for the Municipal Services Division: if someone is appointed permanently under the health program, do they still have to take a test once the program has expired?
Okay, so no, they do not. Once the program expires or the title is deleted from the rules, they would be considered the same as any other competitive class employee.
Okay. Is there a link or a contact to identify the qualified incumbent exam detail?
I'm sorry, could you repeat that last part?
Is there a link or a contact to identify the qualified incumbent exam detail?
Oh, the details.
Can you elaborate a little bit on that process too? How does the county develop and implement this type of examination?
Sure. Well, I can comment on the process, but I believe Michelle might be better off describing how she creates the exam, because it's a local exam. Also, Montgomery County has been using the QIE rule. So basically, local civil service agencies have rules that it's sort of like the daily operating procedures, and what they would need to do is adopt this rule that would allow for these qualified incumbent exams. And the exams are, very basic. They're not exams that are provided by this department. The local agency can develop them on their own, and it's typically a couple questions. As far as how it's implemented, as long as the rule has been adopted, the exams can be administered as needed, and actions can be taken by the local agency without involvement from the state or any additional rules changes or anything like that.
Okay, thank you. Let me also thank the New York State Civil Service Employees Association, or CSEA, our largely local government union, for their support of this program. The question for Ontario County: how are you handling promotions? Specifically, not having employees able to qualify for a promotional exam since they are non-competitive and don't qualify for promotional exams. Any issues from the unions based on your program?
So we haven't yet had we haven't yet had promotional positions where internal candidates, I don't want to say wouldn't qualify, that they weren't considered for the position. So all of the internal candidates were considered equally, and actually our department head so far has only used internal candidates, so they're not actually competing necessarily with outside people. They just no longer had to take the exam to kind of be considered. So the unions right now are supportive of it because they think it means that people are being promoted on their own merits and performance in their roles, their current roles, and their history with the county, and not necessarily how they did on an exam. So far, we've only received support from the union with respect to the HELPS program, and they actually were big fans of it initially, because the whole reason we started this was to fill basically our numerous vacancies because of the labor shortage. So getting more people in was something that they were all in favor of.
And if I could add on to that, we're going to be issuing guidance fairly soon, where time spent serving in an NY Helps status title, we're going to advise local civil service on how to word their promotion clause so that it includes that experience. So that is something that we're aware of as well, and like I said, guidance will be going out soon.
If a county if a county has an existing eligible list for a position but wants to add a public health title to the New York HELPS program due to an ongoing recruitment challenge, how should they approach the situation? MSD?
So, okay, there's an ongoing recruitment challenge. So I mean, honestly, I don't know if this is overly simplistic, but they would want to approach their local civil service agency to talk about the eligibility of that title for being included in the program. It's the local civil service agency that really will be the direct contact for these types of issues.
Okay. Can you elaborate on the qualified incumbent examination? Is that only for the New York HELPS program?
Yes, that is only for the HELPS program.
Okay. How does this program help to hire nurses? Nurses do not have to take an exam anyway. They are T&E. I don't know what T&E means, but I'm sure everybody else does.
Yeah, it works the same for them for training and experience exam positions. So that's what T&E stands for, training and experience. It's a training and experience exam is basically someone will submit their application and maybe fill out a questionnaire, and that's what gets graded, and they get a score that gets ranked on an eligible list, the same as they would for a written exam. So this would affect those types of positions the same way.
So can you elaborate a little bit more? How does the program help to hire nurses?
So if there is not a mandatory promotion eligible list, the title, whatever the nursing title is, can be included in the HELPS program. And as long as all the criteria is met and the local civil service agency goes through the process of changing the rules, that you could make non-competitive appointments to that position.
Terrific. What happens to employees hired under the New York HELPS program after the program expires in 2026? Will they need to have to take an exam at that point to maintain their employment? I would say the answer to that is no, they are permanent, but I'll leave it to you to give us that answer, Anthony.
Yes, that you are correct. They would be permanent and there's no further actions needed.
Okay. If an employee is not hired under the HELPS program, is there any way to use the HELPS program so they don't have to take an exam to become permanent?
So this is somebody who is provisional?
Must be not hired. If the employee is not hired under the HELPS program, is there any way to use the HELPS program so they don't have to take an exam to become permanent?
Okay, gotcha. Well, the HELPS program could still be used. I mean, they could receive a HELPS program appointment just by virtue of the fact that they're already provisional wouldn't preclude that. But there's some other ways where titles can be removed from the rules. It doesn't have to be necessarily. Titles can be removed from the competitive class in other ways, not just the HELPS program. And if there's an extreme recruitment difficulty, that would be another thing to talk to your local civil service agency about, because they could submit rules resolutions, for other reasons. If there's a demonstrated recruitment difficulty where every time the exam is held, fewer than 3 people are on the resulting eligible list or are willing to accept the appointment. Not to go down a rabbit hole, but there's multiple ways that can happen.
Okay, for Ontario County, 2 questions. Have you used or considered using the New York HELPS program for positions in the coroner's office or medical examiners?
So we only have 4 elected coroners. We don't have staff. I mean, they're housed or budgeted under our public health department, but the only positions we have are the elected positions, so it hasn't been applicable for them yet.
Okay, second question, if you have a provisional employee and the title has just been approved through HELPS, but the exam is being held next month, how are you handling that appointment? Are you leaving the employee provisional until the eligible list?
So we've actually done it both ways, depending on kind of when and how close the exam is being held. We have had provisionals where an exam has been ordered and, the date may be set, but it's, further than a month out, where we will appoint them under HELPS so that the person, and this is speaking with the department head in terms of the employee's comfort level with taking an exam and if they have any concerns in terms of their status. And so if they do have any of those concerns, we'll appoint them under the HELPS program. If they feel comfortable and confident, we will wait and let them take the exam and then appoint them under the competitive eligible list. So we do both ways depending on the needs of the department and the comfort of the provisional appointees.
Okay, thank you. Anthony, we want to return back to this issue of training and education. So the question remains, nurses do not have to take an exam. They come in through training and education requirements. If a nurse is going to come in through New York HELPS program, how is training and education relevant? Is it still relevant and or required?
So in order to qualify for a position, you have to meet the minimum qualifications. So that usually involves training and education requirements. But that's it. There's no. So when I was talking about the training and experience exam, that is still an examination where a score is provided. But the whole criteria for this program is that would not be necessary if it meets the criteria for the program. So if there's no promotion list, essentially is the most likely hurdle to get over, that title can be added to the program and this training and experience exam wouldn't be necessary. You could still hold the exams because that would sort of give you options for how to fill the position. If somebody's immediately reachable on an eligible list, that's obviously better than a HELPS program appointment. But you could also have, for the example before where the title is approved in the HELPS program, but the exam is coming out in a month. There's still the criteria for eligibility for the program still wouldn't change at that point. So local civil service would have options, but I would assume that you'd want to get started on that HELPS program process because that's really going to be helpful in a lot of ways.
Okay.
Steve, can I speak to that as well?
Absolutely.
Okay, so I will just say, for Ontario County, we have not submitted into our HELPS program any of our T&E or training and experience titled positions, mainly because, as Anthony alluded to, the T&E is a simplified exam. It really is basically someone posting their resume and getting a score on what their past positions and education is. And so again, not that we don't want to make it easy for them, but it's fairly simple anyways. And so we can still hire public health nurses through that component and get them competitive status. We use it more in the areas, like I said, the public health titles that you saw. One of the criterias or the minimum qualifications could be a nursing license, but that alone wouldn't get them a T&E exam. They would normally have to take a full different exam for like the public health educator, the public health specialist. And so that gives them still the opportunity to come in without worrying about taking that exam. And then they really are coming in on their qualifications. So as Anthony mentioned, every job spec has minimum quals, and those still remain even with the HELPS designation to the title. So someone would still have to have that nursing license or that bachelor's degree or whatever the other criteria is for any title that's put in through HELPS.
Okay, one last question, and then I want to go back to Sarah Ravenhall for closing comments, if she is available to do that. Last question is, the county is saying we'd like to add a particular title to the HELPS program. It's our understanding that the title has had a number of individuals apply for an exam and therefore would not be eligible. However, the challenge is having a diverse pool of staff, and the rule of three has regularly ruled that out, and that we've recruited and trained, as well as a resulting non-diverse group of candidates. Is there an argument to be made at the state level for additional consideration for including these titles? Anthony?
Yeah, I would encourage that person to call our office. Okay. I'll give you the number. I'll just read it off here. So they can call me directly. I'm at 5435.
Can you repeat that one more time?
Sure, 518-473-5435.
Okay, that is to reach Anthony at the New York State Department of Civil Service, Municipal Services Division. I'll give the last word to Sarah Ravenhall, and then we'll conclude. Sarah?
Thank you so much again, Stephen. Wow, what a wonderful webinar. Thank you to all of our fabulous presenters. Thank you to the New York State Civil Service System and Governor Kathy Hochul for her support of the New York Health Program, which is obviously proven to be a very effective tool for our counties and local health departments, specifically Ontario County. Thank you for sharing your wisdom and expertise. I often find that the best way that we can learn and try new things is to learn from one another. What are our neighboring counties doing? So kudos to all of your hard work for this. And for all of the local health departments on the call today, I think we did learn that New York Helps is there for you to make sure that some of those hard to fill positions are included in the Helps program, and you can be an advocate for yourself in your county to fill and recruit hard to fill positions. Thank you to Molly Fleming. Thank you to Alex Reagan and everybody on today's call. I really appreciate you all being here. And if there's anything we can do from a public health, local health department standpoint, you know where to find us at the New York State Association of County Health Officials.
Thank you, Sarah. That will conclude today's webinar. Have a wonderful day, and thanks again for all that you do in our communities.